Hello, everyone. My name is Allie Henny, and I am Vice President of the Witness, a Black Christian collective. And I guess I really should probably give people a chance to get on here before I'm just out here like, oh, hey, I want to start this thing. But anyway, I'm here. I see people are joining. Yes, people are joining us. That is so wonderful. That's awesome. All right. Okay, yes, we're here. Let me give a second for more people to join. All right, all right. Okay, I see all kinds of people. Okay, all kinds of people are coming in here. That's awesome. Alrighty, so let me introduce myself again. My name is Allie. I am the vice president of the Witness Black Christian Collective, and I am so excited to bring you all this production tonight. It's not really a production, we're just here, gonna be on live, talking about birthing while Black. And so, my good friend and the writer of the Black Women Plant Seeds column, Kristina Button. She is going to be on here. I saw her jump on. So Kristina, if you're here, you can request to come on and I will let you on. And we will start talking about birthing while Black. Now, I really hope that you all have had a chance to read Kristina's series, Fighting for Black Wombs on the Witness blog. It is legitimate. It's really good. We also, if you had your eyes out there, like on Twitter and different places, you might have seen where we ran a series that I had written a couple years ago called Birthing While Black, telling some of my stories of being a Black woman and trying to give birth out here. Okay, so I'm gonna bring Kristina on. All right, waiting for Kristina. She's coming. There she is. There she is. You look so lovely. You always look so lovely on these lives. And I knew that you were going to look lovely. And I still came on here look like.
Oh my goodness. Oh my word. Oh, I've been looking such a mess this week. So I was just like, this is my opportunity where I can do something.
I knew Christina's going to be here just looking like radiant. And I'm going to be on here off brand. But it's okay. Girl, this is your time to shine. So excited for this conversation and talking about birthing while Black. So the last part of the Writing series just ran today, and let me tell y'all, Kristina's story, and she'll, we'll go back and forth and probably swap not necessarily horror stories, but just things that we've experienced or whatever. But if you have not read this series on the blog, you need to read this series. These people these care providers, Kristina, girl, these people were trifling.
Yeah.
Like, so there were so many points in your story that as initially whenever you had sent this in, it was like a long draft that was about like 2,700 words. And so I looked at it and I was like, I'm not gonna like run all of this all at once.
Yeah.
Break it up into parts. And first I was like, okay, at the first read I was like, oh, it's 2,700 words. Okay, let's read it. I'm like, okay, why? Story kept going. I was like, it just kept getting worse. And it was one of those situations where it's like, you're reading it and you think, okay, like that was the thing that happened, but like the rest of it's not going to be that bad. And I read it and got all the way to the end and I was just like, how did this
yeah.
So, oh my goodness, there are so many reactions that I have. So I'm probably going to jump all around here.
That's totally fine.
So something that if you don't know, if you haven't read the series, Kristina is the mother of 5. So she has been through this 5 different times, and you can correct me at any point that I'm wrong. But in your for your first births, you actually, for your first 3 pregnancies and births, you had a Black OBGYN, and
Mm-hmm.
it seems like that experience was really great. So we'll touch on that experience here in a moment. But your 4th pregnancy, girl. tell us about that. Tell us about that 4th pregnancy. You actually relocated. You relocated from Southern Virginia to Northern Virginia, from like the Newport News, Hampton Roads, that
Yeah.
area, up to Northern Virginia. So tell us first of all just about all of moving while pregnant, because I moved early in my 2nd pregnancy, so it was an ordeal. But you were 7 months pregnant and moved. So tell us about that.
I just had a memory of, I was actually in an accident when I was 6 months pregnant, moving up here. So we moved here, and a week later, I got in a car accident. I actually ran into the back of someone because the lanes were very weird. And
Mm.
so one thing I remember from that experience was when the police were called, even though I was the one who hit the person in front of me, um, like they never checked on me. Like they never asked if I needed to go to the hospital. Like I was pregnant. Like you could see, I'm not one of those pregnant women where, I could throw on a sweatshirt. I mean, it was in the summertime. Um I had like a mid-length dress on that had like a strap. So like when you tie the strap in the back, it actually enhances your stomach even more. So it wasn't like they didn't know, but I just sat here remembering that as you were asking me about my transition from moving. But that was one thing I remember. Like he gave me a ticket and they never asked if I needed to go to the hospital or anything. Yeah.
Oh my
Yeah.
goodness. So then in the midst of that, because you're
Mm-hmm.
pregnant, and of course, I mean you rear-ended someone, but you didn't have a doctor at that point.
Right,
So
exactly.
so what did you even do? Like did you call the doctor? Like how did you even
I
act
don't know. Yeah, yeah.
in an accident while you're pregnant, while you're
Yeah. So I was wrestling with whether or not I would go to the hospital myself. And it was just that experience was just so stressful and traumatic, and like you said, I didn't have a doctor, so I didn't know like what to do. And so even though my mom was long distance at the time, my mom's a registered nurse, and so I really just kept in contact with her via phone call and just letting her know like what my symptoms were, if I had any, if the baby's moving, doing like kick counts that you do when you don't feel the baby and stuff like that. But yeah, that was my first entry into living in a new area, being pregnant and having that sort of, I completely forgot about that I got into that accident. And even though I was the one who rear-ended somebody, like they never asked me if I needed to go to hospital, if I was okay. Like he gladly wrote the ticket. He gladly ticketed me. And yeah, like unbelievable. But yeah, yeah,
oh
my
my god.
mind blowing.
That is so insane. I wasn't even gonna go here. I didn't, because I didn't know that story.
Mm-hmm.
I wasn't gonna go here, but you think about that idea of not having a doctor,
Mm-hmm.
experiencing something that was a medical emergency. I mean, you
Yeah.
were like you bumped into somebody, this
Mm-hmm. Yeah.
impact that really could have been like horrible. And
Right.
for those of you who don't know anything, whenever you're pregnant, stuff that might seem like a little,
Right. Yeah.
you check. Like we
Right.
always, I mean, and a lot of times it's like, it is not. there are things that, you know, with subsequent pregnancies, like, you know, like, okay, well, you know what to look for, you know what to, you know, watch for, stuff. But there is like a thing of when you have a doctor and one that you can just call. So for instance, during my first pregnancy, my insurance company actually had an advice line. They had just like a nurse line that you could call at any point and just ask a question. And so, like, you know, there was a time that I gotten like a really, really bad headache, and I couldn't remember, because my headache was so bad, I couldn't remember whether I could take Tylenol. Like, I knew there's certain medicines that you can't take. And so so it's like, I think that you can't take ibuprofen, but then I leave. And so I was like, I can't remember if I'm supposed to take, if I could take a leave or not. So do I have to go and go to the pharmacy or whatever? So I just called the advice nurse and they told me. But what you said, like, it reminds me of during my second pregnancy, I had also moved. I think I was like 6 or 8 weeks whenever we had. And so then whenever I was about 13 weeks, like, we were still like in the process of getting settled into the house that we were. And like, I called some different clinics, but just couldn't get in anywhere. So I didn't actually have a doctor. And I wrote about this in my piece from a couple of years ago, that I just all of a sudden started experiencing, like, I had a stomach ache, but like it persisted for a couple of days. And I should just say anyway, like, it's pregnancy. There's going to be some TMI stuff in here, probably. because people who've given birth to kids, you just
y'all already know.
Dignity, like, for practice. Like, yeah, I have the hemorrhoids. I'm sorry if you're the type of person that's just not like into that type of talk, because it's gonna happen. So anyways, I had a stomach ache, and so I was trying to decide, like, I was like, am I constipated? Because I had a stomach ache, because I was feeling sick. I was always sick during pregnancy, really sick. It was just a horrible scene. And so my stomach hurt. And so I was like, am I constipated? It didn't quite feel like it was muscular. Like, because sometimes, like, when I would throw up so much that my belly would be sore.
Wow.
Would be sore. So it was one of those things where it's like, I couldn't quite locate the pain. Is it inside? Is it outside?
Yeah.
Doesn't feel like cramps. I'm thinking, like, I don't think that I've been number 2 in a while. And so it just kept on going, and I'm just like, I just don't feel right.
Yeah.
And so normally I would have just called the advice line and been like, what do I would have told them my symptoms. They would have been like, hey, and they would have told me, okay, you need to go in. Also, I had a clinic. I could have just made an appointment.
Yeah.
I could have just gone in, but because I didn't have a doctor, I didn't have anything, I had to go to urgent care. And so I went to urgent care. And I was just like, I'm pretty sure that I probably just need like a prescription for a stool softener or something. I don't feel like I'm having contractions or anything, but they were like, let's just go ahead. They did an ultrasound and all that type of stuff. They did some blood work, and it was whatever. And so, like, we were waiting. I saw the baby, and I knew enough, like, okay, the baby, like, it looks okay. Like, she looks like she's okay, but I was still waiting on test results. So we're sitting, I have my 2-year-old, my husband's there, and we're waiting and waiting and waiting and waiting and waiting. And so looking at the time, and it's like, it's getting close to the time that the clinic is like closing now. Why said anything to us? And so we're waiting. Finally, I was just like, I looked at my husband, and I was like, I think they forgot about us. We were just sitting in this exam room, waiting for test results, waiting for work, waiting for stuff waiting for the ultrasound. Like, as far as I knew, looked like it. Yeah. I'm not a sonographer, so I'm like, waiting for them to. So is everything right? Like, okay, waiting for test results, waiting for whatever. Like, the person who did it, I think at some point, like we kind of knew that things seemed like they were going to be okay. Waiting to make sure that stuff wasn't okay. So, girl, my husband went out, and then like he went out, and I could hear like all the people talking and stuff, and like you could tell, I couldn't hear what they were saying, but you could tell like they were really like shocked that he had emerged out of the back here, and they forgot about me.
Oh my word! They thought they was in there by themselves.
Literally, they were.
Wow.
They had thought that they had seen everybody and had gotten everybody out. They were the clinic down. Like they were turning lights off and on their way out the when, when my husband goes up and is like, yeah, we're still here. So they were like, oh, okay. So they called down, they called over to the lab real quick. They were able to make sure, they checked the computer, they were able to make sure, okay, everything's fine. And if you still feel bad, just come back in the morning and we'll see. It's like, so that I did, they ended up scheduling another procedure for me. Like I had to go get a CT scan or whatever, but I was just left like with nothing, with no recourse, no kind of support, nothing. All the same, if something really was wrong, and we had gotten back like bad test results and they didn't know, it would have been all the same. Like if I was in labor and I didn't know it, they just left me at the clinic. But those two incidents are like very indicative, I think, of you could look at, like, in my case, you could look and say, well, hey, it was just a simple oversight, maybe there was nothing racial to it. But you have Black women here who, in a situation, you had just had a car wreck, I was complaining of abdominal pain, those are serious things, even though we were okay, and it wasn't like you were in this horrible wreck and the airbag had deployed. That it wasn't like I was, cramping and bleeding and leaking fluid or whatever. But those situations were just enough that that thankfully nothing was wrong. But oh my goodness, what if something had been wrong? What if wrong? And the lack of care that was shown for us, just completely just disregarded. Just, I'm gonna hand you my ticket and meet my little quota for whatever, and then drive off and not make sure that you're okay. Hey, you're gonna be here complaining of pain, whatever. We're gonna take some labs, we're gonna do an ultrasound, and then we're gonna leave you in a room and not tell you any of the results of anything that was going on. But the reason why I asked you that, so that would happen, but what I wanted to get into that was in the article is you were talking about in the article how you were looking for care, and because you were 7 months pregnant at the time, there were a lot of obstetricians who wouldn't take you on as a patient because you were so far along. Do you remember anything about like what some of the rationale behind that would have been, or like why? Because you ended up, spoiler alert, you ended up in this position twice, but we'll get to that second here in a moment. But with that first pregnancy, so you're just there, and you're just out here having to find a doctor and being rejected time after time, told, so sorry, can't do this. Why was that? Did you have any indication of why that was?
I think they said it was their policy. But it's just like, I was like on the telephone pleading with them. I'm like, hey, like I just moved here. Like, what do you do for people? Like, people relocate all the time. Like, what do you do for people who relocate in the middle of their pregnancy? Y'all just don't take them. You know what I mean? Like you just.
There are people that move there all the time.
Exactly. So it's like, can y'all make an exception? Like, can I, so it was a lot of, I think it was a lot of, it was their policy. They didn't really want to take on a patient that far along. And I was just like, hey, like I have my records, I have my medical records, like I can have them faxed to you by the time I come to the appointment. So it was just the policy. I think them saying it was their policy was probably the main reason that they cited. But I mean, some offices were like, hey, yeah, we'll allow you to book an appointment with us. So it was like, some policies can be, bended, or, you know what I mean, to allow for somebody to, I'm just not out here like not gonna show up for appointments or anything like that. Like I'm 6, 7 months pregnant and I'm like looking for a doctor and I don't know a soul in this town, this county, you know what I mean? Several counties, you know what I mean? So yeah, that was their main reason, I guess, was the policy issue. But I mean, policies can be overridden and
Right.
yeah. So yeah.
And something that I found really interesting with that, though, whenever we start talking about this, becomes a racial disparity. This becomes
Right.
a disparity
Mhm.
because there are a lot of Black women who don't seek care for their pregnancy until they're far along,
Mhm.
because so it's like this weird feedback loop.
Yeah.
A lot of us don't seek care because
Mhm.
we're treated. So you go as long as you can,
Right.
and out without seeking care, or there could be various reasons, like
Yeah.
the medical racism,
Mhm.
maybe have the resources, people maybe not knowing that they were pregnant for a while, and then you don't know, and then you're 3 4 months along, and
Mhm.
it's like, oh wow, okay, I guess I
Mhm.
should find set an appointment.
Yeah.
People that maybe don't have the resources or the education level to know, like, oh,
Mhm.
whenever you're pregnant and you know that you're pregnant, like you
Yeah.
start like lack of experience. That's
Mhm.
not just like you wait until you're showing, like you go you go
Right.
as soon as you know. That's those of us who have the means to, that's what we do. And
Right.
that's a system. Those policies are even like a system that ends up disadvantaging Black women. And I don't think those particular policies necessarily were put in place just to say, okay, well, we don't want the Negroes in our practice.
Right.
That's a very interesting policy to have. Like, you're just not gonna take somebody's you're not gonna take somebody's business, essentially, because
Mhm.
how long they were. So you finally find a doctor,
Mhm.
and then what happens with your fourth pregnancy?
So my fourth pregnancy, I had been searching like I live in the DMV, but the V part. And so the way I was searching, the way my search looked like was starting in my particular city, branching out to the city next to me, the city up north, and so trying to just go kind of further out and how it would kind of eliminate um doctors was, yes, having a Black doctor was a priority, but then it was just kind of like, it's almost like you have certain expectations that you're looking for, and you realize like, hey, I can't get these expectations met, and so you start really thinning out those expectations and what you're looking for in a doctor. And so really what I really wanted to see was that the doctor had a good bedside manner and that they actually care and that they were actually empathetic. And I just wanted to be treated good. You know what I mean? I didn't want a rude doctor who had horrible bedside manner. I hate when people say, it's a good doctor, but they have really bad bedside manner. And it's just like, you know what I mean? It's just like, well, I don't want that kind of care. Like, I want you to be empathetic and show compassion and be a good doctor too at the same time. So I found one practice that I was like, oh, thank you so much. Like, you're like, she was willing to see me. Driving there was a nightmare because this was my first time driving in like DC traffic, and I had to go through the 395, 495 interchange and all that stuff. So yeah, it was crazy. And as I wrote in the article, we didn't know anybody here. And at that time, this was my fourth child, my fourth pregnancy. And I had 3 kids. I think at that time they were either like 6 under, or I think they were 5 under. So I had 5 of them under the age of 5, excuse me. And so I had to bring them with me. And DMV offices, like practices, they're small, like they're tiny. And so I finally find the place. I go inside. The receptionist was extremely kind. I told her, I said, I had a horrible time getting here with GPS, and so she was kind and compassionate, and so she starts taking me to the back of the doctor's office, and I got myself with my pregnant stomach and my three kids. You know, I had already gave them the talk, like I had already packed up the snacks and made sure that, you know, they're not gonna be loud and they're gonna be quiet, and you know what I mean. So being hyper aware of just of our of the space we're taking up and just our presence in general, and if we're going to feel rejected in the process of like are they willing to take me on as a patient going forward. So once I get in there, now this was a doctor who I had saw mixed reviews on,
Mm-hmm.
and I had seen some reviews saying like her bedside manner was kind of off, and so I was just like, okay, but she's willing to take me. So it was just one of those things where I was just kind of like wrestling with the care or being able to be in a practice that would actually accept me and actually commit to delivering me. And so once I got in there, like she immediately, it's almost like she honed in on us, like me and my three girls. It's
Mm-hmm.
almost like she honed in on us, but it's also like she wasn't fully present either. So it wasn't like I didn't have eye contact with her,
Mm-hmm.
or she didn't have eye contact with me. So it was almost like she was in the room, but almost like she knew, like she sized me up so quick. Um, I had a ring on my finger, so she automatically just started to make assumptions about me being a single mother. Almost the assumptions like, you know, um, I'm having a bunch of kids without birth control. You know what I mean? Yeah, like it was a lot of that. Asking me like, how am I gonna make it with the three kids and the fourth one? Like, who's gonna help me? And it was just awful. And I was just like, are you serious? Like, it was so
First visit, she was
first, first visit, first and last.
so this woman, you got your three kids in here. She sees you
Mm-hmm.
like you're there by yourself,
Mm-hmm.
and you're very pregnant at this point,
Mm-hmm.
and she immediately starts going into like, oh, you're a single mother. Oh, you must not be using birth control. Oh, you must need to be educated. Oh, you must need to be whatever.
Yeah.
Did she actually do any of like the real appointment stuff? Like,
Uh, I mean, that overshadowed it though, right? Like, if she did, it overshadowed it all. Like, I have no. I'm sure she probably did. Like, she probably noted, you know, how far along I was, but like all the other stereotypes she kind of threw on me just overshadowed everything. And so, man, like I got out of there as fast as I could, and as I had written in the article, I was just so distressed. I strapped my kids in the car, turned the AC on, grabbed my cell phone. It was like, I don't know, it was probably June or July by that point, and I was due in August. And I just called my husband on the phone, and I was just like, that was the worst experience I've ever experienced. And I was just crying. I was just like, oh my word, like that was horrible. So not only, you know, the candor of her being rude, but then also just uh her stereotypes of black women. So yeah, it was horrible. So that was my first and my last time ever seeing her, and I was just like, nah, like nah. Like, and so if you're willing to treat me like that in the office, like, how you gonna treat me when it's time to deliver? And maybe if I do have maybe I do have a healthy delivery, but what if I need a C-section? Like, I don't want you cutting me open and you are um implicating these biases, these stereotypes on my body while you're cutting me open. Like, no, like, no. So, whew, so yeah.
That part, whenever I got to that part, I was just I felt so angry reading that.
Mhm.
So, there's so much I know in my own experience, and so I have two kids. And so not I have a number of an acceptable number of children. I guess it depends on who you are. If you are my mother-in-law, then two, like, she wants, you know, like a bunch of grandkids. That's like, well, no, I'm sorry. But but I mean, two is like, you know, an acceptable number. Three, what I'm told, is an acceptable number. But then once you start to, you're on that fourth pregnancy. I have lots of kids who have, I have lots of friends who have many kids, and there gets to be a point anyway where people get really intrusive and start to,
Yeah.
they start to throw their opinions on you,
Right.
start to say just like really rude things like, oh, well, you know what causes that, and
Yeah.
kinds of stuff. So you already have that anyway. But in my own experience, I think of being a Black woman in these spaces and feeling the need, but like feeling really like hyper visible and invisible at the same time, but
Yeah.
feeling really hyper visible. Like whenever you're talking about, like, you had your kids like huddled in the corner and like, trying to not take up too much space.
Yeah.
Like there are so many times that like I have felt that very thing of being at the doctor's office, being at the pediatrician, whatever, and making sure that my kids are acting the way they're supposed to act. And so already feeling like really feeling really just kind of intimidated and dwarfed by experiences. And you're saying this as the daughter of an RN. My whole family is in healthcare. I've got aunties that are RNs, LPNs. My mom is a clinician. Like, there's all these things. So we're going into these situations
Right.
knowing how to talk to people in the medical profession, knowing what questions to
Yeah.
ask, and we feel intimidated. And so think about somebody who they're not able to speak the language, they're not able to understand the thing, and they're coming in, and maybe it is a mother, because I mean there's a stigma like on single mothers. Like, maybe there's this woman who does have 5 kids, and like, actually it's none of your business like where the dad is, and actually it's none of your business if I know how to use birth control. Actually, like, a lot of this stuff is none of your business. And how humanizing that experience really is. And so I felt, whenever I read that part, I felt really angry for you in that experience, and really angry for you that not only did you experience that indignity by yourself, but you had to experience it with your children, with your older children in the room with you. And of course, you know, them being under five and under, they're not understanding like the full weight of everything of what's happening, but like they are part of like experience that was really, really heavy. So girl, I gotta get to this doctor that you had during your 5th pregnancy. So your 4th pregnancy, you had your son. It was wonderful. Like, I mean, you know, things were different. You can read the article to know a little bit more. But during your 5th pregnancy, oh my goodness! So you had been diagnosed with a disease, that a rare infectious disease, and so you had to shift your care from your birthing center, from your midwife at a birthing center, to a conventional doctor. And so you go to see the doctor, and on your 2nd visit, she's like talking about doing a membrane sweep at 37 weeks. Now, I have to give the audience a little bit of context here. So, if you don't know, if you're not a birthing person and you don't know, pregnancy is usually, we've Christy and I have been using months here, but that's easy, like colloquially, to kind of talk in terms of months, but we actually think in terms of weeks, right? And so it's 40 weeks is typically a pregnancy. And so some people might go 41 weeks, try to not, can get kind of dicey if you get into 42 weeks sometimes. Amniotic fluid starts to dry up. But then 37 weeks, that's the first week that a pregnancy is considered full term. Baby that's born at 36 weeks, it usually is okay. Like, you know, a little bit of time in the NICU, but usually 36 weeks can even be okay. But 37 weeks is like the earliest that a child can be born and be considered full term. But there's still 3 weeks there where there's still development happening. Now a baby can be born at 37 weeks. Be healthy and everything else, and like that was just the time that they were supposed to come. But it's always best often to go into as much as you can. And some people can't go into birth on their own. Some people need to be induced. But typically, you know, you want to go into birth naturally. You want to. And so anything that is done outside of your body doing something else is considered an intervention. And so have an intervention, the greater number of interventions that you have increases the likelihood that you might end up having to have a cesarean. I'm a cesarean mom. My first baby was born cesarean. My second baby, I had a successful VBAC. And cesarean is not like the end of the world, but the thing with cesarean is that it is major surgery, and so that increases risk. So essentially, what you're trying to do is you're trying to decrease risk. You're trying to decrease the risk to your body. You're trying to, the recovery from a cesarean is like 6 weeks, like time that it takes. And you already have like a baby and stuff that you're trying to take care of, and you're trying to heal your body. So it's like I said, cesareans aren't like, cesarean, but it's like, but that's it's not the worst thing that can happen by any stretch of the imagination during childbirth. But you don't want to have all these. As you have more interventions, and if they're unnecessary, every intervention can potentially put you at risk for infection. It can put you at risk for all sorts of things. So we try not to have like a lot of interventions, right? As much as we can. So this doctor is wanting to do a membrane sweep. And you can Google what that is. We ain't gonna go into what that is on here. You can Google what it is, but it is, my doctor attempted to do one because I was 40 weeks plus, and couldn't even get to the membrane to sweep it because it was a lot. The procedure was a lot. Okay, fam, you're just gonna have to trust me on this. But my baby was full term. Right. She was wanting to come at you, sweep it, whenever, like right at it. And why, Chris? Why did she want to do that?
So I think at that point, I think my appointments were probably they were about to start picking up every week at that point. I think that first appointment, I might have been like 33, and then I saw her maybe when I was like 35 weeks. And so the 35-week appointment, that was the appointment she's like, yeah. I mean, like she had it determined, like we was gonna sweep your membranes at the next appointment. And I was like, because she said she had a wedding to go to. And she had already in her mind, the first appointment I came to her at 33, already in her mind was like, oh, her due date on my niece's wedding day. So she told me at that second appointment that I saw her, she's like, yeah, I think I want to go ahead and sweep your membranes at the next appointment, and we can go ahead and get this, the labor going, because my niece's wedding is actually on your due date. And I was like, I didn't say nothing to her. I knew right then. I said, we're not coming back here. We are not coming back here at all. So no. But yeah, it was all centered around the fact that her niece was getting married, and like no care or concern about my body or you know, denying my baby that extra time. Like, I'll take the 3 weeks. Like, I might be tired of being pregnant, but I'm gonna take the extra 3 weeks for the full development. So yeah, it was a hot mess. And so it was actually two offices there. Her office, she was the only doctor at that location. And then there was another office probably like 10 to 15 minutes like further from her office, which was also further away from my house. But that at that other office, it had more doctors at it, and I think I recall there being maybe one doctor that was black there, black woman. So I was just like, I'm gonna gamble here. Like, I'm gonna gamble and hope that she's available for my delivery. And I met her. I had an appointment with her. So my 37-week appointment, like when I said I was done, like as soon as they usually have you make your appointment before you leave. And I said, I'll call you guys. I gotta check my schedule. And so I said, and as soon as I got home, I contacted the other location and I was like, hey, I was at this location. I want to switch here. And so they were like, cool. So at my 37-week appointment, I met her and the female doctor, and she was great. I loved her. We were just talking about just the rest of my pregnancy, me going to full term. So just the drastic difference in care. It was the same practice, but a different office. But the drastic difference in care of her expecting me to go full term, like, and if I was gonna go early, her expectation was it was gonna be on my own. No talks of stripping membranes or anything like that. But yeah, just such a drastic concern for my well-being and my baby's health at the time. Just from switching to this white lady doctor to the female black doctor, like so drastic. So yeah.
And y'all, I'm not going to ask Kristina about this birth. And the reason I'm not going to ask you about this birth because y'all need to go. It is a trip. It is a trip. I'll give you one spoiler on this birth. So the black doctor that Kristina had was ended up being out of town whenever she went into labor.
Mm-hmm.
So y'all gonna have to read this story because the story is a trip. Like I keep telling y'all,
if it was like something out of a movie, that's how I felt. Like,
oh my god.
Yeah.
I like because I had read whenever I read your initial draft, I had read it like I was reading it in parts. I edited it in parts. I think I did like read the whole thing once or twice, but I was editing it in parts. So there was a point whenever I got to the last part, editing the last part. So I was telling my husband about what's going on. I'm like, can you believe that they did whatever? So I got the last part. I got that last part, and I finished reading it right before lunchtime. And I went to my husband and I was like, they did this and this and this and this and this, and my husband's just like, I mean, he knows who Kristina is, but he's just sitting here like, oh, that's really bad, but oh my, like going
Yeah.
on. But y'all have to read the last part is the conclusion to the fighting for Black wombs series, because Kristina's story is a trip. And we experience so much racism. And so we talked about the pre-delivery, during the prenatal period, having these experiences with racism, dealing with stereotypes. So you haven't even gotten into the doctor's office yet. And Kristina shares, or hasn't even like you're really fully gotten to be seen by the doctor, and she experiences stereotypes. She experienced all these things that were just really dehumanizing and devastating. You get into a doctor wanting to do an unnecessary medical intervention for her convenience. Now, that really speaks about like how almost like you were just like this object to her. Like,
Right.
oh, really inconvenient for me. It's inconvenient for me. I want to go to, like, it wasn't her own wedding. It was her niece's wedding. It wasn't like her own wedding. Like, even then it's still like, well, I mean, but you're an obstetrician, and like, why would you, like, I mean, but your own wedding, okay, I get it. Like, I get it, fam. But like your niece's wedding.
Right.
Really? I mean, I could almost empathize. I mean, not to say that you need to do an intervention on somebody because you're getting married, because your kid are getting married.
Mm-hmm.
But I almost understand if it was like you or your child, but it's like your niece. Okay,
Right.
girl,
Listen.
girl, send her send her that OBGYN money that you making. Like, for real, you can't. Why are you doing this?
Yeah.
But you talk about experiencing racism in those places. I will share just briefly from my own experience of experiencing racism, so we can see. I want y'all to read the series because y'all need to read the series because
Mm-hmm.
yeah. But in my own experience, I gave birth to my first daughter in Virginia, not very far from where Christina lives. And my second daughter was born in Missouri, and the level of care, the type of care, there were definitely differences that were there.
Mm-hmm.
So I mentioned earlier that I given birth to my first daughter via cesarean.
Mm-hmm.
So typically for a cesarean, the minimum stay for a cesarean is hospital's 48 hours. Why was I out like 24 hours after?
Wow.
24 hours, like, or in that time period, a little bit more than 4 hours. After I think it was like maybe 36 hours after I given birth, and like the minimum stay is 48 hours. Like you were to 48 hours. There was a baby boom for whatever reason in the hospital that I was at, and there were, I think, something like 11 people who all had due dates around the same time. We're going to be giving birth at the hospital, and so the hospital had this specialized maternity ward. Really, really, really nice. Gave birth cesarean. I got everything. Got off the epidural or got off the medicine, whatever. And so they came to us and they were like, okay, well, we're experiencing overcrowding here. And so since you can walk, you can go home. You're good to go home. So,
No.
So I could walk.
No.
The prerequisite
No.
that I had gotten out of bed, like, I think like maybe earlier that day.
A C-section, Allie. You can walk. So no.
So after a cesarean, they taken the little booties off of me. I was off morphine. I wouldn't even tell stories about like how. So I'm allergic to. Apparently, I'm allergic to some of the stuff. Probably morphine, but some other stuff that was in humming thing. So I itched from like the inside out, and I had that was horrible. Sadly, she was Black also, but she was horrible. So yeah, so I was on the floor and was walking, and so my oldest was born Easter Saturday. We were there. We spent Easter in the hospital, and then Easter Monday I went home. And Easter Monday I was home by Easter Monday evening. And so, and let me say this: I gave birth almost at midnight. Like I gave birth like 11 o'clock on Easter Saturday. It wasn't like early in the day.
Yeah. Mm-hmm.
Like it was Sunday basically. Sunday by the time I actually got into my room, and settled in. So that happened with my first birth. The second, there were all kinds of other like crazy things that happened, but that was the big thing. So during my second birth, was trying for a successful to have a successful be back, and I did have a successful birth with my second. Well, during while I was laboring and everything, I got an epidural, and so but I had a doula with I managed to have a doula. My sister was my doula the first time, but my sister, because she lived close to me, but then the second time, I went through an agency and got a doula, and so my doula like insisted on, even though like I was on the epidural, she insisted on like still turning me. And so like I'm 5'8", I'm 5'8", 5'9". The bed that I was on was only made for somebody like 5'4", 5'5", something like that. So my feet were always hanging off the bed. The bed was super uncomfortable because it wasn't like a full medical bed. It was like some sort of bed that they just had here. It looked like it was from like this.
Oh my goodness, Allie.
That they had in this delivery room. So like my feet are like hanging off the bed, and I'm big. I'm heavy. Like I'm tall, and I'm big, and so the nurse, she was having to work to turn me and stuff. And I remember at one point, like I was feeling a pressure point because even though my legs were numb, like I could still feel pressure, right? Mm-hmm. Hey, I'm on a pressure point, like this isn't comfortable for me. So she was really super inconvenienced by that. She was just really super inconvenienced by my here in the delivery room, but she's the nurse that's supposed to be taking care of me. And so the whole time, because I'm having to be turned, for my baby was kept on going off the fetal monitor. I had to be monitored. My doctor ordered that I was monitored since I was VBAC. She was like, since I was previous cesarean, I needed to be monitored all times. The nurse thought it was an inconvenience. She didn't have to do anything else except for keep the heart monitor on the baby, but for whatever reason that was a big inconvenience for her. Where my nurse had gone, she had disappeared for some reason. So another nurse came in the room, and she came in the room to get linens. Like my room had a linen closet in it, and she needed some more, and so she came to get some linens out of the linen closet. And so she walks in and she stops and she's looking, and because I'm just kind of sitting there kind of like, okay, cool, I'm in labor, and and so the nurse stops and looks, and so I was like, why is she looking at me? So the nurse is like, I want to try to get that fetal monitor on you a little bit better, so you could hear like the heartbeat and stuff like in the room or whatever. So she's like, I want to try to get that fetal monitor on you a little bit. So she gets it on there and she's digging around, and so she's like, I think your baby might be breech. And so I'm like, what? She's what? No, fam. She's like, I think like that's not good. She's like, I think she might be breech or transverse or something, like something doesn't sound right. And so let me go get the doctor. We'll do an ultrasound. And so she got the doctor. The doctor did an ultrasound. Turns out that my baby was presenting with like a brow presentation, which is like, in most circumstances, it is impossible to be born with a brow presentation. Like that is like, oh, prep the room. We're gonna do a cesarean. You can't do it. And so so the doctor was a doctor that was on call. It wasn't my OB. My OB hadn't arrived yet. So the doctor did it, saw the brow presentation, and was just like, I think I can fix this. And so she fixed it. She just pushed the baby back in and got her, pushed the head back in and got it, whatever, and then walked out like it was no big deal. And I was like, okay, cool. So the nurse looked at me and was like, you don't realize how lucky you are.
Wow.
Like you don't real like. So after the doctor had left, she was like, a brow presentation, especially in your condition, like that isn't like, you cannot give birth that way. And so that's an automatic trip to.
I mean, can you even imagine like you're actually like, if she hadn't come in the room and they were going on as business as usual.
They were going on business as usual. So then the other thing, like, so she knows all the doctors in the hospital. She's like, there's only one doctor that could have done that. And that could have fixed it the way that it did, and she just walked out the room. And so I was like, oh my gosh. So, yes, God and baby Jesus and everything were looking after me. But I'm just out here like, my nurse, this was not even my nurse.
Wow.
Heard something. So this whole thing had been happening the whole time.
Wow.
was presented, and I'd even had complained whenever I'd gone in. I felt I was feeling like I needed to push, but I wasn't dilated. So I knew, and she's also possibly OP. She's also face up too. So I thought, well, maybe that's why I'm feeling pushy, is because she's physically face up. But she's brown presentation, and like my nurse didn't even do the due diligence.
Wow.
You're sitting the fetal monitor around doing all this, didn't even do the due diligence to be like, oh, well, maybe. And I honestly think that what happened was because I was trying for a VBAC and had a history of cesarean, that it was basically like this was an inconvenience for her, because why don't you just go ahead and have a cesarean? In fact, whenever it got to the point where I was pushing, where I was coming to push, she was really lazy in showing me how to push. And so like I'm sitting here, I've been in hours, and I'm just like, she's trying to explain it, kind of trying to do all this other type of stuff. I'm like, okay, I need for you to break this down. I don't understand what you're trying to do. Like I'm trying to push like you. I'm trying to like do Kegels or whatever. Like essentially, like I'm thinking that I'm pushing, right? And like I'm just like I need help. So I turned to my doula. I'm just like, I don't know what she's telling me to do. So my doula was just like, act like you're trying to poop. And so I was like, yeah, oh, that's okay. Like explaining like this, she's one like have me hold like a blanket and pull. I'm just like, see what I need to do to push,
right?
So because I don't want to go to the OR. And there's a bunch of other stuff that was happening, but it was like, ooh, you might need to go to the OR here in a minute if Steph doesn't. And so I'm just like, just tell me what to do. I know that I can do this if you just tell me what the heck to do. And so then sure enough, as soon as I knew what to do, so then my OB, she was really super cool. She got there. It was time for delivery. She got there. And so then my OB, thankfully, because the nurse wasn't doing jack, my OB jumps in and it's just like, she's like, okay, come on, you can do this, like whatever, we're gonna do and whatever. But like they were prepping the OR for me because I was losing a whole bunch of blood and everything, and it got kind of scary there for a minute. For me, everybody else was, I guess I was the baby. I was mostly okay, but just got kind of touch and go there. But I share that experience. I'm gonna be like, oh, horror story, war story, but like I want you all to see the steps here, to see the progression here of being in the space of giving birth, and you're telling people like things are happening, and people aren't believing you whenever you're saying, hey, I'm feeling like I need to push, and hey, you're only dilated at 5. Maybe you should start pushing now. And nobody thinking like, red flag. Hold on, maybe we need to check something out.
Yeah.
A situation where you have a nurse that just really just didn't want to be there, didn't care. Something even as like small as my body was too big for the bed that I was in, and I was so uncomfortable the whole entire time. Now, I'm not saying that all of those things happen because of racism. Like the beds in the birthing unit of the hospital are notoriously terrible. It wasn't I was Black, but I had a horrible bed. But all of these things found, and it's like there's one. It's like if there's one thing that happens to a white woman, it's like happens to us like 4 times worse. And so like, if a white woman maybe comes in like to a similar situation to me or a similar situation to you, like maybe ever, and she immediately receives the care, but like we can end up dying in these situations, like where somebody doesn't listen to us. Like, I mean, I think Serena Williams, like she's an oh my goodness, y'all, this is like really, really horrible. So I got kicked off, apparently. I hope that people start coming back in. Okay, Christina's back here. So I got kicked off, apparently, because my internet is like not that great in my basement, and I need to fix that. I'm happy that you all are coming back. Okay, so I'm gonna add Kristina back. Okay, adding Kristina back. We were getting like right toward the end too. This is such a shame. Okay. Hey, sorry about that. Oh my
That's
goodness.
okay. That's okay.
Uh,
I saw the glitch and I was like, is it me? Like, what's happening? Like, what's going on?
Same, same. I was sitting here like, okay, Christina's frozen. So is this me or is this Kristina? Then I got your text. Is like, you got kicked off. I was like, no. So you know something. Whenever white women experience something, and negative things during childbirth. It's bad. It's horrible. I want to acknowledge out here saying like, oh, well, somehow we experience things in birth. They're worse in the sense of any less devastating, any less whatever. But it's times that some of the experiences that we have um, end up becoming worse. So like I think of somebody like Serena Williams, who is a world class athlete. It's her job to be in tune with her body. It's her job to, and she's telling her physicians, I don't feel right. And they don't believe her. And she almost dies in childbirth because she had a blood clot or something like that. And she almost dies in childbirth. And so Christina, I was wanting you to speaking to that reality of what are some of the things that you've seen, because you've given birth 5 times, and you've been through various experiences with giving birth and everything, and you probably also know a lot of other birthing people. And so like what do you think is behind some of the disparities, and some of the, like, even just from the relational level? We could talk systemically, we could talk about the stats, we could talk about us being like 3 to 4 times more likely to die, but at the ground, somebody who's done this multiple times, what's behind some of these disparities, do you think?
I definitely think it's the well, I think there was a study that came out, we that has been discussed about Black people not being able to Black people don't feel pain. Um, they feel pain less than white folks do.
Mm-hmm.
And so with that, and supposedly that was in some medical books. And so if that's still in medical books, and that's the foundation that they operate off of when Black people come into the hospital. When we say, we're in pain, or I don't feel right, or I have to push, but you're telling me no. Those are critical. Those are they're minor, but they can lead to very critical, even fatal decisions for us. So I think it boils down to us not being listened to. So a lot of the stories that you and I were just talking about, were like, this was said to us, or you saying, for example, in your story about you being like they literally forgot you, and even though even though you were there and you seemed to be doing okay, like what if you weren't, like what if what happened to you led to a fatality for you and your family, you know what I mean? And so when we say, like, when we emphasize why Black maternal health is so important, there's still racial biases in the healthcare system. There's still this myth that Black people experience pain less than other people of other races. And so, I mean, if there's not a slogan or a tagline that we could say more, is definitely to trust Black women in these situations, and that we have healthcare advocates. Like that's I think my birthing experience has really shown me how much I need a healthcare advocate. And even so, now that I'm not having children now, but even just with my own medical, situations that may come up in the future or whatever, just my birthing experience have definitely shown me that it's so super important for Black people to have a healthcare advocate, and have like a birth, not excuse me, have like a medical almost like a birthing plan, but like what's your medical plan like if something happens in case of an emergency, because they like they don't believe us, they don't believe Black people when we do come to the hospital, and the pain that we are saying like, hey, something's not right. And so and I think in the article I had wrote, it gets exacerbated for Black women, um and we don't get that care, that concern, the advocacy, the compassion. So yeah, we might have a good doctor, like you had a good doctor, it seemed like, for your second pregnancy, but then your nurse was being janky, you know what I mean? So it's just like, it's those critical moments that could lead to fatality for ourselves, or our unborn children. So yeah, it's a lot.
Yeah, and, I think about like that advocacy component. Like I shared earlier that during my first after my first birth, I had cesarean, and I was sent home like 36 hours or something like that. Like it was less than the bare minimum, like
Mm-hmm.
bare. In fact, something that I didn't say is that I was in the hospital longer with my vaginal birth. I was in the hospital for longer than I was after a cesarean. Like I was in there like almost, I think, a full day longer. And that was like with like we had group B, so like I had to take some like antibiotics or whatever, but that like that's horrible. Like that's not like I had major surgery.
Yeah, I mean, that's that period of time. That's like an observation period for you to stay in the hospital after you have a C-section, and they like, we out of room,
We're out of room.
we out of rooms, and you can walk, so you
Go
good, go home. Like how? Like how does that work?
kills me about that though, because I honestly did not think anything of it when
Mhm.
it happened. I was just kind of like, oh, okay, cool, I get to go home, awesome. That like kind of scary, but cool. I did not think anything about it until,
Mhm.
and of course my brain is gonna blank out on her name. But it was actually after my second birth, probably like a year or two after my second, or yeah, but probably a year after my second birth, I heard a story of a woman who had it was all over the news, and I wish I could remember her name. Lord forgive me for not her name, but she um had given birth via cesarean. She went home. I think that she was also sent home
Mhm.
earlier than what she was supposed to be sent home. Her blood pressure spiked, and she ended up dying. And so for me, the thing that got me too, because after I had gone home with my baby and everything, I had the follow up appointment not very long,
Mhm.
and I had actually gone to the OB, and my blood pressure, it wasn't my blood. I probably even tend to have like low blood pressure. So my blood pressure, like my whole pregnancy, wasn't over the top number wasn't over 120 like ever. But then it was 138 at my first postnatal visit. And so 138 isn't a bad blood pressure at all, but it was high for me. It was very
Mhm.
very high for me, when like my normal blood pressure would be like 100 or 95 or something like
Mhm.
that. So like my OB was just kind of like, okay, well that's high for her, but it's nothing to be concerned about. And I was like, okay, went home, whatever. The nurse did like ask me like, are you in pain or anything like that? I was like, no, no, I'm good.
Mhm.
And I like, oh, I got sent home early. I had my blood pressure was high for me,
Mhm.
and that didn't trigger any red flags for anybody. And like I could have been this woman, so I'm alive somehow. I didn't have a blood clot. I didn't
Mhm.
eclampsia, because you can actually get eclampsia
Mhm.
after
Mhm.
birth. People don't realize that about it, like as happening during birth, but you can actually develop it. And I think that might have been what happened to this woman, is that she developed after birth. It doesn't happen after birth,
Mhm.
it can happen. And I think like, oh my gosh, like that really could have been me. And
Mhm.
that her story and the Serena Williams' story really shook me up. Like,
Mhm.
it made me, because we know that medical racism exists.
Mhm.
Oh, we know that it's a thing.
Mhm.
But then who have experienced it, and then having to go back and like look back and be able to name and be able to put your finger on this happened, and your process experience afterward, and you're like, okay, well, this happened,
Mm-hmm.
and then this happened, and then this other thing happened, and then this doctor did, I said something and the doctor didn't believe me, or I had to keep repeating myself
Mm-hmm.
to the nurses. Thing that happened to me a lot in like postnatal care, of like not being believed. Like I people like remember all these things. Like I blacked out at one point. Like after my second child, like I blacked out, and like I told the nurse that I blacked out, and I don't remember, like I was in the bathroom and now I'm here and I don't remember how I got there, and it's just kind of, the nurse was kind of like, oh, okay, and just kind of smiled and whatever, and I'm like, but I just lost a bunch of blood, and like I'm telling you that, like shouldn't you be doing something? should this should this be a red flag? But somehow, even through all of that, okay, cool. Like I made it. But there's so many Black women that don't make it through.
Mm-hmm.
There's so many of us that don't make it through, and that's scary. Whenever
Mm-hmm.
I think about it, that's really scary that there are people who are giving birth. They're women, they're Black women who are giving birth right now,
Mm-hmm.
who might go through horrible experiences, and they might not make it out of those experiences alive. And so you talk about having an advocate, you talk about having people who are there, to help speak up, if not for you, to help add their voices to yours, and having a plan. What's something that we who are here, who are listening, who are in the audience, what do you think that we can do, to help bring awareness to some of the disparities and things that Black people experience, that the Black birthing community experiences?
Yeah, so I mean, you and I are just, speaking from our personal lived experience, but keep having those conversations with Black women, trust Black women, but also there's a lot of organizations that are already doing that work, to further bring awareness, further to provide resources for Black women that aren't, necessarily extended to them, because of the racial disparities. Um, so yeah, I think it's important to connect with local organizations and just um, see how we can better serve them because they're out there providing resources to women, um, whether it be like donations or something like that, financially, or even just, I think sometimes some birthing organizations have lists where people can help give, diapers and stuff like that. So I think following organizations and continuing to um, have those conversations with Black women about their birth stories and actually caring about, wanting to learn more, how to be a better advocate in that area is super important. Um, I think I was even thinking about it would be great to have sponsorships and stuff like that where women could be sponsored because like we some of us got insurance, but even with insurance, like it's expensive. Like, and just think about the people who aren't afforded healthcare or insurance, like, and that was an issue, something you brought up earlier on, like sometimes folks don't go to the doctor because it costs money. Like it costs money. Like they want to birth their babies, but it costs money, and so they try to wait it out till the last possible, you know, a week or month that they can go get admitted to see a doctor. Um, and so yeah, I mean, in all those areas, the resources, breastfeeding. I don't even think we talked about that. I think I saw something. I think I saw statistics saying like um, Black women aren't afforded um, the ability to breastfeed, and so they're offered formula. You know what I mean? They don't have the education. It's kind of here's your baby, like like the education's not there, even within the hospital, and so it's like you over here struggling trying to learn how to breastfeed your baby, and they over here offering you formula, but you're like, I want to provide my child with the most natural element that I can give them, and it's my own milk, so yeah, so all of those things, more education, asking those questions to, I mean, there's organizations locally in everybody's neck of the woods, you know what I mean? And so search those out, like make it your business to find out where there's places that are helping. Midwife centers are good starting places. Um, so yeah, yeah.
Yeah, that those are all excellent things. The other thing that I would say that I would add to that is there definitely are, Black doulas.
Yes. Yeah.
A doula, if you're not familiar with what that is essentially it's a person that comes in
Mhm.
during birth, and they are there for the mother. So they're there to help care for they're there to help care for the mother. So in my experience, remember my sister acted sort of as ended up kind of becoming my doula during my first birth. And so I mean she was there making sure that I had like all the rags and everything that I needed to try to help my pain and whatever. And then like my actual certified doula was there, helping me, making sure that I ate. Because during my second birth, I was able. The hospital was like, yeah, well, yeah. I couldn't eat and drink during the first one. That's a whole other different story about what you're allowed and not allowed
Right. Yeah.
to do during birth. But during my second pregnancy or my second birth, my second delivery, I was allowed to eat, and so she was there, sure that I ate, making sure she was the one that I had mentioned earlier that I was really young. That I had an epidural, but they were still turning. She was like, we can still turn, because she's just like, we can still make sure that you're in good position.
Yeah.
For helping birth. And so she was really there to help me be able to advocate for myself. So as I'm in a place where I'm like, I have
Mm-hmm.
happening, and she was able to explain like, hey, this is what's going on right now, this is what they're saying, this is what I think that this means, and really able to be there to help me make decisions, to help through what the doctors were telling me. And that's something that's a role that I
Yeah.
think is so important. Um,
Mm-hmm.
is so important during births, and I think that especially my doula was awesome. However, my doula was a white woman, and so things that I think that she might not have been aware of,
Mm-hmm.
that Black doula would have things dynamic
Mm-hmm.
that
Yeah.
on. Even more so, being able to have that, and whenever you think about like prenatal care, um, being able to go to like birthing centers, being able to go to women's health centers that are geared specifically for Black women. If it's not Black people, if it's not Black healthcare specifically,
Yeah.
pregnancy center or something like that, where
Right. Yeah.
to get resources, to get information, to get knowledge, to get reassurance, to get referrals.
Right. Yeah.
I think in your situation, Kristina, about how you were brand new to your city, you were brand new to the area, had no idea where to go, who to talk to, what doctors could take you or whatever. How much it would have been, how important it would have been for you to be able to have a Black birthing center or a Black pregnancy center that you could have gone to, or a network or something like that, somebody that you could and could have said, hey, I'm in this area, can you help me find a doctor, can you help me?
Right. Yeah. 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 Mm-hmm.
You were in your car accident, somebody, that a resource that could have helped you.
Mm-hmm.
have helped you. Like there are so many things, and you know there are those resources do exist in different cities and different localities. But I really feel like that it would be great to see these types of things happen on a national level, to see people to see people taking the initiative and the level of care and concern for Black birthing community, to make sure that parents are aware of everything that could go on during childbirth, that people are aware, and not just aware of the disparities. So sometimes I think that being aware of the disparities, like you can it can freak you out, right? Like you can be like, oh my goodness, like am I gonna die, like whatever. But so having that knowledge is important, but also feeling empowered. Like I have this knowledge that these things could happen to me, but feeling empowered then. So I've heard some of Kristina's story. I've heard some of Ellie's story. Then hopefully this empowers you now. Do you know now that if you we learn from stories, we learn from telling stories. So hopefully now that you know, if you are somebody who's in the Black birthing community and you know someone who was in a car accident, you get in a car accident yourself, that you know, oh, okay, I've got to do this. You know, hopefully that your experiences, if you've ever felt left or forgotten or something, one, and to be able to name that and be able to say, okay, you know what, some of the things that I've experienced in and in my prenatal and in perinatal care, these things were racism. Some could be racism, and even just having another aspect of that is you know, is therapy. There's some of us that have that we might need to talk to someone about. You know, a lot of times people just kind of I remember after my first pregnancy, after my first birth was like, it was a good experience. It wasn't like terrible or scary. I ended up having a cesarean, but even like that wasn't bad. But I was unmedicated for a lot of it. It was like a lot, which I mean, a lot of birthing is a lot. It's a big situation. I remember talking to someone afterward, and I remember I was in a group of people talking, like sharing afterward, and there was this man, of course, because of course it's always going to be a white man. That's going to be like, you're always going to be a man. It's always going to be a white man. That's going to be super dismissive. And I remember like saying something like, you know, yeah, I just remember being like, because it had been after, and I was just like, yeah, you know, I was in labor for this really long time, and I was like really I was unmedicated. I was in back labor. Like it was really difficult. And this guy just really dismissively is like, oh, you know, yes, I know. You will always have, you know, the worst birth story of anybody that's ever. And it was just like really like kind of like I know, you know, it was just like really dismissive. Like, and I don't think that he was necessarily trying to be dismissive. But it's like, this comes off as super dismissive because, you know what, at that point, I'd only given birth once. And it was like, this is like, you know, the experience of my life here. And, like, I know because I have enough friends and family who've had children, who've had multiple children, and I've heard their birth stories. And I know what exists, right? But I'm saying, like, you know, just in this moment, I'm just kind of like, yeah, like that was that was something that was really, oh, and you're being dismissive about it. Come on. And so, like, I think that we need that space to be able to talk, to be able to say, like, whatever, to be able to name our experiences. And sometimes that even needs to take place in a therapeutic setting, because some of us have stuff that happens that's like
traumatic.
Traumatic. I mean, like, you know, with my for me, my experiences were just sort of like, wow, these are really inconvenient. Like, you know, my kids are happy and healthy, and I'm, you know, not happy and healthy, and they're more just kind of inconveniences, and they're kind of like, I'm really super like annoyed by this, and I can see the racism in it, so I'm mad about it. There are some people that have been through some stuff that it's like, we need to talk about that. Like, that advocating for Black women, and advocating for the Black birthing community. That was my low battery notice. I know that I probably went off. I'm having all kinds of trouble here tonight, people. But anyway, that's probably my signal. Like God's like, wrap it up, wrap it up.
Oh, man.
But anyway, you know, there are a lot of us in the Black birthing community that we've had these horrible experiences, and I think that a point of advocacy for a lot of us is even just like listening and back. And if you know someone who's given birth recently, sitting back and listening to their story and letting them tell you their story and letting them as you them letting them process that, especially like now during COVID-19, where it's like you take that experience of birth. All of our birthing experiences happened like way before the pandemic, but then like you add the pandemic to that, and
Right, yeah.
I just can't even imagine. And so there's going to be a lot of people who like need us to listen to them, and I think that's like the ground level advocacy is listening.
Yes.
But anyway, do you have anything else you want to say, Kristina?
Yeah, just really quick, just a pinpoint, and maybe people can go, do a Google search, because I think I saw some articles, but just what you were saying about, like we already been talking about the racial disparities with Black women, but it's more heightened now in COVID. And so, and it kind of intersect too, the mental and emotional part of pregnancy is it can be so overwhelming. And then you add on, just you like going through pregnancy is emotional already. It's your hormones are all over the place. And then you add on the level of racism that you experience when you go to doctors. And so the mental and emotional part, piece, I feel like I wish that that was talked about more in pregnancy, for women, uh, pre-pregnancy, during pregnancy, post-pregnancy. I wish that was talked about a little bit more, but I definitely am an advocate for therapy. But now, even more so as we have this conversation, therapy within the context of Black women being pregnant. But yeah, just wanted to highlight that, for further research for people who are watching and participating, but also like there's Black women's having babies in the hospitals, and we're already struggling now in the midst of COVID. And so there's a lot of Black women in hospitals who you can only have like one person, come visit you. And of course that will more than likely be, your spouse. So, you don't, so things are limited. Things are more limited, for women, especially for Black women now in the midst of COVID. So giving birth in COVID, and I'm sure it's been some tough times. So yeah, just wanted to highlight that. For There's been a lot of COVID, a lot of COVID babies and stuff. So just check on Black women who are in the middle of this season of giving birth, and as Ali said, listen.
Well, that was great. Well, Kristina, it is always a pleasure talking to you. You can catch Kristina on her column, Black Women Plant Seeds. She has a lot of great thoughts. I hope that you all will read the Black Womb series, like for real. Read it. Read all these trifling stories that she's told. I'm still a fan. I'm holding on to that last story because I need for y'all to off it.
Yeah, I'll go. Yeah.
And give us some clicks also. But you can catch her on that column. You can catch her over on her page, on her Twitter account. Just everything. With Kristina's everything, and it's such a pleasure to know you, friend, and to be on here talking about just whatever with you. And
you as well. Yeah. Thanks for having me up here. And you had texted me. You're like, hey, like, should we do a live? And I was like, yeah, we should do a live. It's we have a week for this, but I think one of my notes that I have put, like when we have Black History Month, like we always say we Black 365 days a year, but Black women are having babies every day. So um and the racial disparities continue to persist. So check on Black women who are carrying babies, and show them the empathy, the tenderness, and the care that you would. So
Well, it sounds good. Thank you.
bye, y'all.